morning. Welcome back to Open Med School. I am Dr. Andrews, Professor of Medicine and Consultant Neurologist. Last time we have discussed about the mental status, and one of the important abnormality that you will come across is coma. Any patient with a coma, the findings has to be recorded in a validated scale. Today I will be discussing on the Glasgow Coma Scale. So what are the components of the Glasgow Coma Scale? It has got three components. One is the best eye response. There is four points are there. Second is the verbal response. Best verbal response, it has got 5 points. And the best motor response, it has got 6 points. So total will be 15. There is no 0, so the total score will be 3. So the minimum score will be 3 and the maximum score will be 15. This one point to remember. Now we take one by one. First is the best eye response. So here you can see a patient who is comatose and the patient is not opening the eyes. The score will be 1. You give painful stimulus, the eye opens, it becomes 2. Patient opens the eyes to sound, it is 3, and the eyes are opening spontaneously, it is 4. So step by step, remember, no eye opening, it is 1. Opens eyes to painful stimulus, it is 2. Response to verbal response, it is 3, and normal, it is 4. Now we go into the best verbal response. No verbal response, it is 1. There is only incomprehensible sounds, that is 2. Inappropriate words, it is 3. Patient is confused, it is 4. And oriented, 5. Again, it is in the hierarchical order. You remember, patient is responding, oriented, it is 5. Patient is confused, so it becomes 4. Patient makes inappropriate words, then it becomes 3. And the words are incomprehensible, it is 2. And no verbal response, it is 1. Now we go to the best motor response. Patients obeys commands, it is 6. When you give a painful stimulus, localizes, it is 5. Withdraws from the painful stimulus, it is 4. Abnormal flexion, it is 3. Abnormal extension, it is 2. And no response. Again, it is a hierarchical thing. So at patient normal movements, obeys commands, it is 6. Only when you give painful stimulus, it becomes 5. And withdraws from the pain. When a painful stimulus is applied, the patient withdraws, it is 4. Abnormal flexion, something like a decortication, it becomes 3. Abnormal extension, like a decerebration, it becomes 2. And no response, it is 1. So now we have discussed about the Glasgow Coma Scale. This has got a prognostication, the details of which are beyond the scope of today's discussion. Another modification of this score is that GCS minus P. GCS minus P includes the pupillary response also. So what is happening? If both pupils are unreactive to light, you have to subtract 2. 2 is the pupillary scoring. One pupil unreactive, it is 1. And no pupil is unreactive, it is 0. So the patient is having coma, the GCS is 3, both pupils are unreactive, you have to subtract 2. Both pupils are reacting, you have to subtract 0. So the minimum score in GCS minus P is 1. Hope this point is clear to you. So here you can see the classification. GCS P is GCS scoring minus pupillary response. Both pupils are unreactive to light. This is the pupillary reactivity score. Both pupils are unreactive to one pupil is 1 and neither pupil 0. And depending the classification of the head injury is mainly for the traumatic brain injury. Severe head injury is GCS 3 to 8, moderate is 9 to 12, and mild is 13 to 15. And as mentioned, the GCS P score will be 1 to 15. Another commonly used classification, a very easy one in the casualty, is the AVPU scoring. A stands for alert, B is for verbal, patient response to verbal stimulus, P stands for patient response to painful stimulus, and the U stands for patient is unresponsive. So this is called the AVPU scoring. A stands for alert, B stands for verbal, P for pain, and U for unresponsive. Again, there are more extensive scores are there, which is beyond the scope of today's discussion. One is a force score, another is for the sedation purpose, you use the RAS scoring. So force score has got eye response, motor responses, brainstem reflexes, and respiration. So that is another important thing. There is a force score. And the RAS is for the Richmond agitation sedation scale. 0 is alert and calm, and so the details will be discussed in another. And when the patient is intubated, and in pediatric cases, the scoring, there is modification, the score is there. And when you are writing the GCS, you write the T, that is patient is intubated, can also be written. So this will be discussed later. Hope it was useful to you. Thank you.